hope you've had a good lunch and you enjoyed our breakout sessions, and you are enjoying the delights on the table. And I have to say the chocolate is there at my own request, so do enjoy that. So here we are to the anticipated part of the day. I would like to welcome to the stage Vicki Field, who is HR Director at the London Doctors Clinic, and Dr. Preeti Daniel, her medical director, who will talk about the HR toolkit for surviving the current virus.
Thank you. Probably some of you will have heard about coronavirus. It's kind of somewhat in the news at the moment. Our job is pretty much to talk about a few things. So HR's role in managing a crisis and how we kind of embrace the whole medical side of this particular one when it comes to looking after our employees and, importantly, our business as well. So we are in a position where I think we need the classic catchphrase from Dad's Army, just don't panic. Because I think there's a hell of a lot of it out there at the moment. You're all in the HR world, you'll be getting questions from your employees, and I've had a whole range from, my child's got a cough, what shall I do, through to a manager calling up panicked because someone had sneezed in the office. So our role is very much not to panic, but to plan. And I think that's very much what the talk that we're going to do is about today. I'm going to hand over to Preeti to talk about kind of coronavirus and what it is from a kind of health perspective.
I think nothing I'm going to say right now is new per se. It's all available information. But coronavirus is actually a group of virus. It's very, very common. In fact, it is probably one of the commonest causes of a common cold and flu-like illness in the winter months here. COVID-19, which is the new coronavirus, the novel coronavirus, was discovered in Wuhan in China, and the name was only attributed on the 11th of February this year, so it's a very, 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 very new virus. And the reason this has come into the global front line is because it is easily transmissible. It's having very devastating effects on certain groups of the population, and it is having a massive global economic impact at the moment. So the commonest symptoms of having COVID-19, the novel coronavirus, is first and foremost a cough, a dry cough. So if you did have a runny nose or a wet cough, it is actually unlikely to be COVID-19. So if you start having the sniffles, don't panic. A dry cough, shortness of breath, and fever are the triad that we're looking for in COVID-19. And tiredness follows with any flu-like illness. So aches, pains, fever, cough with a sore throat, then you probably ought to speak to someone sensible about what you should do next. Just to remember, 80% of people will have very, very mild symptoms. They will recover. There are 100,000. We've surpassed 100,000 cases across the world now. More than half have recovered just fine. So it really is the vulnerable population that we have to protect. And the reason it's such a global pandemic now, according to WHO, is because unless we protect ourselves, so we protect the well, the working, the walking around, we will not be able to protect the vulnerable members of the society. So it particularly affects the elderly, which is again unusual for coronavirus in general. Any flu-like viruses tend to really affect the very young, babies, pregnant women, and the elderly. But this particular one, we haven't yet seen much adverse effects in children and pregnant women and other immunosuppressed groups compared with the elderly. Unfortunately, if the elderly do get, obviously age is a risk factor, but because their mortality rate is higher anyway, but if the elderly do get, they seem to have a vast number of different complications that we're not anticipating with other flu-like viruses. So this can cause respiratory failure. It means you might be under ventilation, in ITU, and eventually multi-organ failure and death, and that is the problem. So as you know, the WHO declared coronavirus COVID-19 as a pandemic yesterday, and pandemic is a funny word in the health sector, because for a layman, pandemic implies we've given up, or this is it, this is what's going to wipe out, vast majority of the population. But the reason WHO has chosen that word carefully and has released that is because it makes people realize that we have to all do something to prevent this from spreading, whether it's happening in small clusters, in a community, or nationwide like in Italy or China. We will all have to do something, and that is why the word is chosen. It's a worldwide spread of a new disease and rapid spread. Currently the UK is in the containment phase. I mean, I won't really go into too much of the politics side of things. You already know there's a COBRA meeting, there's lots of updates coming out from the government. Professor Whitty, who's the Chief Medical Officer for Public Health England, has had a very extensive meeting with the government. You can have a look at it online, and lots of guidance coming through. So this is going to change probably on a daily, if not sort of every 2 days or so, we're going to get new guidelines. So not to be taken lightly. Is it just a bad flu? For most of us, probably yes. But yeah, so Vicki can carry on.
So I mean, I think effectively we're all in HR, and we have a role to play through this process. We are here to gather and to give information that's to and from employees and to and from our executives. We're here to be the voice of authority. I mean, in these situations, it's a rapidly changing world, and I think it's really important that we talk with authority, we know our stuff, and we can give our executives and our teams as much confidence as possible about what's going to be happening. And then business continuity planning, you presumably all of your companies will have an element of business continuity planning. Our job is to make sure that that's people-focused, that we're very comfortable with what we're doing from a business continuity perspective. And that's in a world which is constantly changing. So what we're going to be looking at is scenarios and how we kind of work through that and look at how we can keep our businesses running. And then finally, a wellness strategy. I mean, Preeti and I work for a private GP practice. Having wellness at the heart of the company is really important, not just at times like this where it's kind of extreme measures, but also on a daily basis. So gathering information. I've said the first one is be data-driven, and this for me is really important in terms of it's a good opportunity to make sure that we've just got our I's dotted and our T's crossed, nearly got that the wrong way around making sure that we have all of our HR systems set up, that people are being reminded to give their contact details. I know there's been a lot of talk about flexible working so far in this, but it's highly likely that people are going to be working from home. So let's make sure that we've got the appropriate contact details in place, your HR systems are being updated, people are being reminded to just make sure that all the data that you hold is accurate. Secondly, as part of that, we're going to be the ones who are reporting on absence. Our executive teams are going to need to know who's in and out of the business, what the picture's like. So let's give them live reporting. Let's make sure that people are putting the information into the systems, whichever one you use, on a daily basis, that they know that their responsibilities are. And then look at how your HR systems are set up. So things like, do you need a separate code to cover self-isolation, for example? So effectively, data is going to be at the heart of managing this whole next few months. Be law aware. I mean, there's a host of HR issues coming up already. And I think employment law and understanding rules of suspension, holiday pay, sick pay, parental leave, all of those aspects are going to be increasing in prevalence. But also, as Preeti mentioned, Public Health England are changing and updating the law and the guidelines every day. It's our responsibility to take that information, make sure that we understand it in the context of our own businesses, and also just to communicate out to our staff what needs to happen. And a lot of this, which Preeti and I will keep reiterating, is we don't have all the answers. Public Health England say, if you're experiencing these particular symptoms, you call 111 and you follow their guidelines. So a lot of what we're going to be saying is just common sense stuff around listen to what Public Health England are saying and follow that through. And then the final one is be forward thinking. So for me, this is an opportunity to look at how we're going to work in the future. And I've seen a host of articles come out saying, is this the change that we've been looking for? So as part of this, we will be looking at a lot of flexible working. There are companies who are still reticent to it, managers who are still reticent to it. And I think it's an amazing opportunity to look at how we're going to do it, to build the best practice policies, to help our employees do it well. So at the end of this whole thing, we can say, okay, we survived, people worked from home, they were productive, they enjoyed it, it worked well for us, and that can maybe transition into future HR strategies. I mean, in terms of giving information, as I've mentioned, the Public Health England are coming out pretty much every day with guidelines and advice. It can be a bit of a minefield for employees. There is so much information. I think what we need to be doing in a calm and common sense manner is giving regular updates, a lot of which is kind of, don't panic, I know it's stressful, but this is what's happening. If you think you're experiencing symptoms, this is what you need to do. In terms of company updates, it very much depends on the type of organisation. We're a medical business, which means that we can't send our doctors home to work. But in our offices, we're looking at what we can do. So things like ensuring that the doorknobs are being cleaned every 3 hours. So we've changed our cleaning protocols. Things like how the dishwasher system works. Kitchens can be a little on the grotty side in businesses. So it's about telling people to keep one cup, and at the end of the day to make sure it's in the dishwasher or washed up with hot water, not just rinsed. It's about offices and meeting rooms. So how do you sit around the meeting room? Do we need to have meetings? All of the things which are specific to your organisation, and just a completely different way of doing things, but just give people confidence that you're taking it seriously, that they can take it seriously. And I think temperature checks are important. We don't always know what people are worried about, and just touching base with employees in whatever kind of internal comms mechanisms you have, just to kind of say, what's worrying you? And a huge amount of the worry is going to be about finances. And I think both from a corporate perspective, we will see companies fold over this. It's a really sad fact, but some people won't survive, and we've already seen a big airline go down. And our job in HR is to look both at the company and at the employee and try and walk that fine line between ensuring the company can stay running and also doing what's good and best for our employees. And then finally, just a kind of coordinated Q&A I think can be really helpful, just putting something out there, all the questions that are coming in, because they will be consistent, and also some of them might surprise you around what people are asking. So just kind of ensure that we're regularly communicating the government's information, that we're giving out our own corporate messages, that we're doing that temperature check, and that we're kind of sharing a Q&A. And then in terms of business continuity planning, I mean, our role is to support our business in continuing to function effectively. That's what HR has always been about. It's been about ensuring that the right people are in the right place at the right time, and that's going to be a challenge over the next few months. From a kind of VR perspective, there's going to be a host of people issues. There are going to be people who don't want to come into work because they're worried. There'll be people who can't afford to live effectively if they're on statutory sick pay. There'll be people who are any situation, people whose kids are ill. We're going to have a whole host of ER issues, and our executive team need to know that we're the ones who can help them step through the minefield of what those kind of issues are going to be, and we do it with calm and confidence. I think scenarios can be really helpful. So role-playing the particular scenarios for your organisation to test your approach. So whether you're a kind of a very consumer-led organisation, or whether you kind of run a restaurant or kitchens, or whether you have a lot of people travelling, or whether you've got clients that people go and see, all of these will have very different issues connected to them. And just getting a few people in what's probably going to be a virtual room to just run through, okay, let's look at all the different scenarios that could affect us, be it, one employee coming in and coughing over everyone and then turning out to have it. What do we do? What do we say? How do we manage it? What's the best practice HR approach? And then I won't go into too much about flexible working, so I know you spent a quite a significant amount of time today. But again, for me, this is about making sure if you don't have a culture of flexible working, you've got the right policies in place. So if people don't have their own equipment or have their own equipment at home, which isn't company equipment, you're very clear about confidentiality policies, about GDPR policies. So if people are sending that customer data home or whatever to their home addresses, everything's kind of being contained. And then in terms of key people are those who are pretty much single points of failure in your organisation. And I know it sounds a bit drastic, but you might want to put specific plans around some of those people. And they could be across the organisation at all levels. It's the one person who knows the one thing that no one else does. And it's like, does that person need to be in? Can they be based at home? And just thinking about succession planning and cross-skilling and just getting some of that training up front. And I think, again, just to reiterate, the vast majority of people who have this won't be seriously ill. They'll just have like a bad cold, mild flu, and they'll be fine and they'll get through it in 2 weeks. It's not like everyone's going to be kind of decimated, but at the same time, we do need to think about it and we do need to plan around it. So, I mean, coming on to the next stage, and I'll ask Preeti to talk about this, but there are particularly high risk groups of people amongst your employee base.
Yes, so I mean, we were talking about this earlier, and I obviously understand that you can't go around asking every employee what health conditions they have, and there's a lot of confidentiality issues, etc. But there are specific health groups that we really want to be aware of in any organization, even in healthcare, particularly those with any cancer, even if they've had treatment in the last 5 years, or are on immunosuppressants. They are particularly vulnerable. Any heart disease, and that includes just regular old high blood pressure, for which you might be on high blood pressure pills. Diabetes type 1 and type 2, and any lung condition. So that could be even as basic as very well controlled asthma, but can be something, COPD, can be any chronic lung condition. These 4 groups of people are particularly vulnerable as a young adult. So these are not the elderly that we're talking about who have other chronic illnesses, but these guys with the chronic illnesses as adults. So from the age of around 18 to 55 is what we're talking about. With these conditions, have to be recognized, have to be invited in confidentially, so that we can put extra measures in place for that group of people, and they're particularly higher risk, basically.
Yeah, so I think, in terms of the law around that, what our recommendation would be is to say, if you're in this high-risk group of people, please let whoever know in your organisation. And then you can look at those specific people and you can create a plan around them, either working with your occupational health team or just from a HR perspective. But I think those people are going to need extra support, and they're the ones who will be extremely concerned because they're the ones who are at risk. And probably just not those people, but also people with children with any of those conditions. Mental well-being, a lot of what we do in our business is looking after mental health strategies. And I think the fact of the matter is a lot of people are going to find this really concerning. If people are on statutory sick pay for 2 weeks, that's £94 a week. It's pretty hard to live on. There's going to be a financial impact to this, as well as a kind of a business impact for people. And I think making sure that you've got your helplines in place, whatever they may be, is really important, that you give people the opportunity to talk, and you kind of let people know that they're allowed to feel anxious. Health and safety, again, this for us is pretty much cleaning protocols. It's making sure that you're conscious about who's in the office, that everything's being cleaned properly, that you're looking after the health and well-being of your people as effectively as you can. Public Health England keep reiterating wash your hands for 20 seconds, and they do that for a reason, because it does work. Some people seem to think it's a blasé measure, but actually containment phase is keeping hands clean, it is keeping offices clean, and just reiterating that at work is key. And then finally, if you do have private health insurance, occupational health or private GP support, It's about ensuring your contracts are up to date, that you know exactly what they cover, because there's likely to be a significant rush on these types of organisations as we kind of go through this, this coronavirus phase. And then I think also for us, we're talking very much about coronavirus, and we can look at the shelves, we can see the empty stacks of hand lotion, there is so much focus on health at the moment, and yet, and I'm not in any way at all diminishing the impact that coronavirus is going to have, but at the same time, the biggest death rate we've had so far, and I hope this is up to date, but the stats are changing so rapidly, was about 156 people, tragically. But at the same time around the world, we had 49,000 people on that same day die of heart disease. We had 2,000 people on that day kill themselves. And I think in HR, we have a responsibility to have wellness strategies in our companies, which aren't just in crisis moments like this. They're looking at these stats and they're saying, what can we do in our organisation to ensure that we're looking after the health and well-being of our employees on a day-to-day basis? Because people are so focused on their health at the moment, and yet they'll be out smoking, drinking too much, eating, just not exercising in a way that just a few changes to those things from a corporate perspective can have a huge impact on these stats, which when we've got this through this coronavirus phase, may be a way to kind of focus on a health and well-being strategy in the future.
Okay, a couple of questions for you.
Sure.
How do you find out staff who have these underlying health conditions that you went through? Can we put a generic email mentioning these conditions and hope they volunteer? What would you recommend?
Yeah, I mean, from a medical perspective, I would encourage employees to speak to either HR or occupational health if there is a department, probably confidentially, anonymously to start with, and then have a one-to-one maybe to discuss what conditions they have. Once that's recognized, then extra measures can be put in place. But I think asking the employees if they think they are in any of the high-risk categories or high-risk vulnerability categories to come forward would be the sensible thing.
Yeah, I mean, from a legal perspective, sending an email out saying, your health and well-being is our priority. We understand you're at particular risk if you suffer from these particular conditions. Therefore, please contact whoever if you do, and we'll set up a confidential call, I think is entirely appropriate. And then if they don't, that's their lookout. But if they do, it feels that we're fulfilling our responsibilities.
How should we respond to employees who can't access their GP to provide a fit note as a result of the increased demand on the NHS at the moment?
The law around it's changing. I mean, Boris Johnson's now saying that it's unlikely that you need to go and see your GP to get a fit note. And I think there's just a point where we are in a state of flux. I think we're in a grey area, and I think some of our standard processes might be edgy for a while it organises.
And I would say please don't go to your GP for a sick note or something like this, because we're turning away so many people with coughs, colds, etc. From my understanding is that the first 7 days you should be able to self-certify anyway, and then after that, the employer will have to be a little bit flexible in this time of sort of very dynamic developments without a sick note. So if you did want a sick note, try and get it on the telephone or video consultations. There's several private providers that will do video consultations, but definitely don't try and approach your NHS GP face-to-face for a sick note.
If you have an employee that has the virus, when are they safe to come back to work?
So if they have the virus, it's proven that they have the virus. It again depends on their age, their complications, whether they're in hospital, whether they've required any treatment, etc. Theoretically, a 35-year-old person who gets the virus, if they're proven to have it, they'll be self-isolating for 2 weeks, and then they should be able to go back to work.
I think this is where a fit note might be helpful.
Yes.
I mean, I personally would want one.
Yeah.
And I think the last question, should we ever get to an Italy-style situation, what's HR's role?
I mean, I think HR's role is the same whether in a UK situation or an Italy type situation. It's to try and keep the business running, and it's to try and look after our employees. Some businesses literally live month to month, and a number do, and paying people full pay for the whole month would cripple them. But at the same time, there are people on, you know, minimum wage who would struggle to live on statutory sick pay. So I think our job is to understand our business, it's to have the correct data in place, it's to be the voice of reason, it's to be the person who's got the business hat on and the people hat on, and just help our companies work through it.
Thank you both very much.
Thank you.
Thank you.
Thank you.